Many patients complain an increase in hair fall. They also complain that they have started using minoxidil and their hair fall has increased. And they worry so much, then they stop using minoxidil, fearing that minoxidil will make them bald. Friends, I will clear your doubt today. Hello friends, I am Dr. Gaurav Garg, dermatologist, trichologist and hair transplant surgeon at Dermalife Skin and Hair Clinic, Green Park, New Delhi. Friends, you must have heard about minoxidil. Minoxidil is a buzz term nowadays. Everyone who faces hair fall or baldness has heard of this medicine. Minoxidil has been used for male and female pattern baldness since more than 40 years. Now we are using minoxidil not only for male and female pattern baldness but also for other hair loss problems like alopecia areata, telogen effluvium, alopecia due to chemotherapy, monolithics to increase growth of beard and eyebrows, etc. etc. With increase in its long-term usage, we want to be sure about its side effects and its effects. A lot of people ask me whether they should use minoxidil or not, whether there are side effects of minoxidil or not, how to use minoxidil properly, and for how much time one has to use it to see hair growth. What will happen if someone stops minoxidil, and who can use it and who cannot use it, and tons of related queries. Today I will clear all of your doubts related with minoxidil. Minoxidil was invented 60 years before, around 1960, as a medicine for high blood pressure. And after some time of its use, doctors observed that patients who were taking minoxidil were showing improvement in their hair loss and their baldness is reducing. With more research and development, minoxidil was introduced in lotion form to apply over the bald area, and subsequently US FDA approved it in 1988 for male pattern hair loss and in 1991 for female pattern hair loss. Next question come in our mind is how minoxidil works. How minoxidil is able to grow your hair back? Well, my friends, I will try to use very simple words and I will not go into the depth of its mechanism of action because that is a subject of pharmacology and you will get bored listening to all those complicated jargons. I will try to use very simple words to understand it better. Minoxidil mainly works by increasing blood flow in scalp. Simple. Minoxidil allows more blood to flow around hair roots and more blood brings more nutrients to the roots. Okay. Minoxidil also increases the duration of active growth phase called as anagen, and it gradually enlarges small miniaturized hair roots into mature terminal hairs. It delays follicular miniaturization. It also decreases the resting phase of hair roots that is called as telogen phase. So in simple words, it increases the size of the hair roots as well as it decreases the growing phase of the hair roots. Once the hair roots become stronger, these strong roots will produce strong hair and subsequently patient sees increase in density and their baldness get covered. So in a nutshell, it works as a fertilizer for hair roots. Now we will discuss the next question, that is, who will be benefited with this, who can use it and who cannot. Many patients ask us, am I right candidate to use it? Can ladies and gents both can use it? Friends, minoxidil is approved for use of both men and women with pattern baldness. We prefer above 18 years of age for prescription in pattern baldness. Before prescribing minoxidil, we always examine the patient properly. And once we are sure about our diagnosis, we prescribe it to our patients. Friends, I will advise you always take advice of your dermatologist before using it. Why I am telling you to ask your dermatologist before using it? Because your dermatologist knows when minoxidil to be given for best results. Also, minoxidil comes in different formulation and different strengths, and your dermatologist will prescribe you the most effective formulation after assessing your baldness. Now I will discuss in brief about different types of formulations of minoxidil. Minoxidil is available in three different forms. First is lotion, second is gel, and third is foam. In lotion form, it is available in 2% lotion, 5% lotion, and 10% lotion mainly. However, 12.5% lotion is also available, but I personally do not recommend it because related high side effects. Studies have shown that in males 5% lotion is effective most of the times and 10% lotion to be given only when 5% is not effective. In females, 2% lotion is effective in most of the cases, and very rarely 5% can be given if 2% is not showing much improvement. Gel and foams are newer formulation of minoxidil, and many patients found it better than lotion. Now we will come to the most important point of minoxidil use, and that is side effects associated with minoxidil. Many patients get excessively worried with the side effects of minoxidil, and they often confuse minoxidil with finasteride. Friends, minoxidil and finasteride both are totally different medicines and do not get confused. Both have different side effects. The most common side effect of minoxidil is itching and dryness over your scalp. Some patients experience temporary increase in hair fall for 4 to 6 weeks after starting of minoxidil application. Hardening of hair shaft is also been experienced by some patients. Very rarely, patients can observe headache and postural hypotension. Some patients might be allergic to minoxidil. It means they will complain of redness and itching after minoxidil application. These patients should stop minoxidil use and should inform their dermatologist as soon as they will feel that they are having this type of complaints. Now I will discuss each and every side effects one by one. Itching and dryness of scalp is mainly attributed to propylene glycol, which makes the base of the minoxidil lotion. Newer formulation of minoxidil like gel and foam does not use propylene glycol activates, and hence gel and foams are less associated with itching and dryness. Many patients complain an increase in hair fall. They also complain that they have started using minoxidil and their hair fall has increased. And they worry so much, then they stop using minoxidil, fearing that minoxidil will make them bald. Friends, I will clear your doubt today. Temporary hair fall after use of minoxidil is common, and actually it's a good sign and shows that minoxidil is working well. So if you have started applying minoxidil and you notice that hair fall has increased, relax, do not get worried and continue applying minoxidil. You must be thinking that how is it possible that if hair fall has been increased after using minoxidil, it's actually a good sign. I will explain you in simple words. Once you start applying minoxidil lotion over your scalp, the hair root shifts from resting phase to growing phase, and hair root start producing new hair. This new hair pushes the existing hair out of the scalp, and this is noticed as a hair fall. So friends, if you have noticed the same hair fall after using minoxidil, do not worry, because it is a good sign that minoxidil is actually working well and you should continue using it. Now the next side effect is powdery residue after application of lotion, and many patients confuse it with the dandruff. This powdery residue is common if you are applying minoxidil lotion more in quantity, or you are applying minoxidil lotion over hair shaft mainly and not over your scalp. Gel-based and foam-based minoxidil preparations are less associated with powdery residue. Hardening of hair strands has also been complained by many patients. If you apply minoxidil lotion properly over your scalp and not over your hair strands, you will not face hardening of hair. To reduce this problem, you can continue shampooing daily also. Very few patients complain of headache after use of minoxidil, and headache is mainly associated with the use of excessive doses of minoxidil or applying wrong percentage of minoxidil lotion over your scalp. Same way, lightheadedness after getting up from bed in the morning has also been complained by many patients, and it is again related with the dosage of minoxidil. So if you feel any of the side effects, I will advise you to consult your dermatologist, and your dermatologist will suggest to you the right thing to do to remove these side effects. Friends, that is all for this part. I tried to explain about minoxidil in this part in very simple words. Watch my next video to understand how to use minoxidil for best effects and lesser side effects. Do I have to continue minoxidil for lifelong? Does minoxidil is habit forming? What will happen to my hair if I will stop using minoxidil after some time? Can I stop minoxidil of my own? For how much time one should use minoxidil? What is the maximum time to see positive results of minoxidil? Does minoxidil work equally in every patient? What's the guarantee that minoxidil will work in your case? Do you have any other medicine in comparison with minoxidil with lesser side effects? Do a patient, if using minoxidil regularly, has to shampoo every day? How much time a day minoxidil should be applied, and for how much time it should be over your scalp? What are the precautions to be taken while applying minoxidil? And many ladies ask me this question: will minoxidil increase growth of their body hair or not? So friends, if you like this video and want regular update, press like and subscribe to my channel. Thank you for watching.